Hi, my name is Samantha, and we're going to talk about fetal alcohol syndrome, FAS. Um, so first, we're going to talk about the description of FAS. So it is a group of physical and behavioral and learning disabilities caused by prenatal alcohol exposure. This occurs when a woman drinks alcohol during the pregnancy. The alcohol can pass through the placenta and potentially harm the developing fetus. This can cause problems in behavior, learning, and the child's physical development. It can be preventable by avoiding any alcohol during pregnancy. It is lifelong, but it does vary from child to child. There is also no cure, but there are some treatments and medications to help with this, and it is also a permanent condition. Now we're going to talk about the signs and symptoms. So, some children may have some facial characteristics like small eyes, a thin upper lip, and a smooth or short philtrum. And that is the groove between the nose and the upper lip, also known as the Cupid's bow. Um, FAS can cause impairment, learning disabilities, hyperactivity, and attention problems. It can cause delayed speech and the language development. Um, it can be difficult for concentration and they may have a short attention span. Um, Sometimes they also have a difficulty of telling the difference between what is real and what isn't. Alcohol does kill different cells in the fetus, causing all of these abnormalities. Alcohol can travel to different parts of the brain, affecting the way they are supposed to function, and we're going to talk about which parts of the brain later on. Alcohol also slows blood flow, which is the food supply within the uterus, and that causes a shortage of oxygen and nutrients to the fetus. So if you are trying to become pregnant, it is best to avoid any alcohol during this because the fetus does go through a big development stage between between the weeks of 4 and 6. So now we're going to talk about the causes of FAS. So, alcohol exposure is the most common cause of human birth defects. Genetics can play a role in this. Only about 4.3% of children with alcohol exposure while in the uterus can develop lifelong fetal alcohol syndrome. In 1988, it was introduced that genetics can play a role in FAS and are more likely to have a second child containing this disorder. And now we're going to talk about the pathophysiology. So, FAS is caused by alcohol crossing the placenta and interfering with the fetus's organs that help it develop, especially the brain. So when the mother consumes alcohol, it passes through the bloodstream and into the fetus's circulation. When the fetus lacks a certain enzyme, which is CYP2E1, which is involved in alcohol metabolism, it can lead to the higher concentration of alcohol in the fetus's tissue compared to the mother. Alcohol can damage the corpus callosum, frontal cortex, hippocampus, and the cerebellum, resulting in intellectual disabilities. Apoptosis occurs in the developing brain cells and can trigger neuroinflammation in the developing brain. This causes irreversible damage to the central nervous system. Most of our data does come from animals through experiment in association with alcohol exposure. And now we're going to talk about diagnosis. So FAS can be diagnosed from an examination of the condition. The earlier the diagnosis for this condition can help the child's ability to function more properly. If you want to watch your child for any symptoms of FAS in the early weeks, months, and years of the child's life, going to regular checkups can help the healthcare professionals watch your child's physical and brain growth and development. Now we're going to talk about management. So you want to know your child and keep an eye on any physical deformities. Um, just so that you can give them the best treatment possible. There is no cure for this disorder, but in research it does show that the earlier the treatment, the better to improve the child's development. Early pre- the early prevention system can help the child from birth to 3 years of age and learn important skills. Children who receive special education to their specific needs are more likely to reach their full potential. There also needs to be a supportive environment recurring around the child that has the syndrome. This can help prevent any criminal behavior, unemployment, and incomplete education. So, it is more likely for children who live in a stable and loving environment that are less likely to develop secondary conditions, which is a result of having fetal alcohol syndrome that is treated during the early ages, than those who are experienced to these factors in life, like criminal behavior, unemployment, and incomplete education. Children of fetal alcohol syndrome need to be taught specific ways to control their emotions like anger to help them later on in life. Children with fetal alcohol syndrome need good baby care, vaccinations, good nutrition, exercise, just like other people or children who don't have fetal alcohol syndrome. Again, there is no cure, but there are several medicines that can help improve fetal alcohol syndrome, like some stimulants to help with hyperactivity, problems with paying attention, and behavioral issues. Antidepressants, which help sad mood, loss of interest, and sleep problems. Neuropleptics, this can help with aggression, anxiety, and also anti-anxiety drugs may also help with fetal alcohol syndrome. It does also just depend on the child and their needs because medications can affect each child differently. Behavior and education therapy can also be a good treatment for children who struggle with FAS. Now we're going to talk about prognosis. So, people with fetal alcohol syndrome face lifelong challenges with cognitive, behavioral, and physical impairments. They have a life expectancy of 34 years due to the higher rates of physical health problems. So, the prognosis for this is very poor. People with fetal alcohol syndrome tend to act out more, have a difficulty of living life, getting into trouble. Children can have memory problems, impulse control, learning difficulties, and social skills. This is also a permanent condition, so earlier support can help improve their life. Children with fetal alcohol syndrome can impact heavily on families that can experience emotional, financial, and logistical challenges. Now we're going to talk about the epidemiology. So prenatal alcohol exposure can lead to cognitive disabilities. In the 1980s to the 1990s, prenatal alcohol syndrome was estimated to occur in the range of 0.5 to 2 cases per 1,000 live births. But during that time, it was not recognized as it was today. So today it does range from 6 to 9 cases per 1,000 live births. There are more higher cases in those of racial and ethnic minority populations, but American Indians have some of the most highest rates overall. Fetal alcohol syndrome has been reported as high as 1.5% among children in foster care. In many cases, this exposure is unintentional because women continue their normal drinking patterns before they know they are pregnant. 7.6% of women report that they have continued drinking during pregnancy. Now we're going to talk about the history and who discovered it. So, the term fetal alcohol syndrome (FAS) was first published in an article in 1973 in the British medical journal called The Lancet at the University of Washington Medical School. A group of pediatricians and psychiatrists helped define the defects and development delays that can affect children due to alcoholic mothers. During this time, they stated that they did not consider alcohol a danger to normal embryonic development. During the mid-20th century, it was recommended that alcohol was a means to social relaxation, and alcohol treatments were even used to delay preterm labor in some women. In 1973, Smith and Jones examined a group of children to see what had caused their development delays. During this examination, 4 of 8 children were observed with the same deficiencies like abnormally small heads and delay in cognitive development. And one thing that made this make sense was that those children that had mothers. One thing that made this make sense were that those 4 children of 8 had mothers who were alcoholics. Therefore, Smith and Jones suspected alcohol may play a role in causing developmental defects that were observed in the children. Having this information, they had continued their studies and revolved around women who were alcoholics and had children with these characteristics. They had then published an article in 1972, The Offspring of Alcoholic Mothers, that described the case studies of children who were born to alcoholic mothers between 1968 and 1969. The journal, The Lancet, had discovered about the deficiencies observed in children whose mothers were heavy consumers of alcohol during the pregnancy. This discussed the morphological abnormalities, cognitive defects, and growth deficiencies that were observed in the case studies. Now we're going to talk about famous people that do have this syndrome. So some famous people with this defect would include Bernie Sanders, Joaquin Phoenix, Reese Witherspoon, and Jim Carrey. Bernie Sanders has a narrow set of eyes and a flat philtrum, which is the Cupid's bow, and has verbal outbursts. Biographers had reported that Sanders' mother had struggled with alcohol misuse before and during the pregnancy. This contributed to his lifelong battles with impulse control and social nuisance. Joaquin Phoenix, an Academy Award winner, had a faint line running down his nose to his lip, which is one facial difference that ties to the fetal alcohol syndrome. He had faced inconsistent schooling and emotional turbulence, which are common struggles with this syndrome. Reese Witherspoon, an actor and producer, had a thin upper lip and small, widely spaced eyes, which are markers of prenatal exposure. Jim Carrey, a comedy icon who had grew up in poverty with a sick mother who had reported using alcohol during rough times to cope with pain. It stated that he had a thin upper lip and a pronounced philtrum, Cupid's bow, along with his lifelong ADHD symptoms that revolved around typical FAS neurobehavioral patterns. So I'm going to go back to slide 1 just to show you guys the pictures if I can. I don't know if I can. So I did end up editing these in, and you can see that in some of the photos that it shows that the eyes are narrow and you have a small upper lip. Let me see if I can. A small upper lip, a smooth or thin philtrum, and then over here you can see the narrow eyes. But that is it. Thank you for watching my presentation for the fetal alcohol syndrome. My references are in the slide before this. Thank you. Bye.